the one and only Dr. Thomas Dobbs, health officer. Good morning, sir. How are you?
Oh, I'm well, sir. Thanks for having me again.
Well, that's good news. That's the first thing we get out of the way, because if the state health officer has it, then we got a problem.
I'm gonna try to be careful. Oh gosh, I mean, sincerely, I'm really worried about the coronavirus, even for my own health. So we all got to be careful.
Let me ask you this, and we were talking about it a little bit earlier, with the news that the President and First Lady have, and I said this a little earlier, from just your perspective, not so much the President himself, but in someone in that category, 73, 74 years old, overweight, hasn't had a smoking history. I'm not sure as far as any respiratory problems at all, but when you look at this, and he's in relatively good health other than that, your thoughts?
You know, it's very concerning, and we can think back to Boris Johnson when he had his illness, right? I mean, I think there's some parallels there, and I think Boris is a little bit younger. A significant number of people in that age group, a significant minority are going to have severe illness, may have to go in the hospital, even have respiratory failure. So it's something very concerning. I mean, most people do survive, there's no doubt, even that older age group. But being a little bit overweight, yes, sir. So we'll watch it closely. And, it may take a while to really know, because it's kind of a biphasic, two-phase sort of scenario where people will be sick for a while and maybe start feeling a little bit better, but after a week, maybe 10, 14 days, sometimes it can kind of go the other direction. So I think it's something that we'll need to we'll have to watch very closely over the next few weeks.
So we're talking about a quarantine period of 14 days minimum for the president?
If you actually have the virus, the duration that you have to isolate yourself is actually 10 days. Pretty much evidence shows that after 10 days, people are no longer contagious to other folks, unless they have a very severe illness and require hospitalization. Then it can go up to about 20 days.
What have you learned? Anything new since the last time we were on when you start getting the data in? Have we had any changes in this? There are, and I specifically asked this question because we've heard again, and I've read two stories on this about the mutation of the virus, COVID-19, that the possible mutation is that it's become a little more benign, and I shouldn't use the word benign. It's become a little bit less contagious, or severity. The contagious part is the same, but its severity is lessened a little bit so as not to kill its host. Have you read anything about that?
Yeah, sir. Yeah, absolutely. And I'm an infectious disease specialist, and we have a network of infectious disease communications about different things. And the mutation rate of the coronavirus is actually pretty slow. And what we've seen so far probably actually does not indicate it's less harmful. We got to be very cautious not to wish away some of the bad stuff, because what we're seeing, although most people do get better and the mortality rate might seem a little bit better, we're treating folks better and we're diagnosing more people. And that's a wonderful thing. But I really do not think at this time the virus has appreciably weakened in its sort of possible severity.
What's the status of the new mask that the president and the administration mentioned earlier this week, as far as the new test? I should say, not mask, the new test.
Oh, okay.
Are we getting
those? We haven't had any yet. Now, some of them have been distributed already to some of the historically black colleges and universities and nursing homes, from our understanding. But the governor's office has been targeted to receive, and they will come through us, a significant number of rapid tests. There will be things that can be done on site, but they have to be done by medical personnel. So it's not something you could really do at home with a target trying to go to K-12 to keep kids in school.
Explain it to us a little bit. How do these work in relationship to the ones that exist now?
Well, in some ways they're similar in the sense that, the experience of the patient's going to be somewhat similar. You do have to do a nasal swab, but it's going to be the front of the nose. It's not going to be the sort of really the deep one. I haven't actually had a chance to use it yet, but then you basically take it and you put it on a little piece of cardboard card. And it's going to be a little bit kind of like a pregnancy test, a home pregnancy test, where you swab it down, you put some chemicals on it, and you close it up for 15 minutes. And if it's 2 bars, you're positive. And if it's 1 bar, you're negative. And about 15 minutes, you should know the answer.
Is it more accurate than the earlier ones? Because when the last time we were on, we were talking about this, and there were some questions that you could have a low level of COVID-19 and maybe not be contagious. We weren't sure about that, but or you may be asymptomatic.
Yeah, so we don't really know. I mean, the other antigen tests, which it checks for the protein, not for the genetic material, they will have some propensity to miss some folks for a whole host of reasons. Same thing with the flu antigen test. It's something that we've known forever. So we'll have to watch it very closely. We don't really have some understanding of the performance characteristics from a field perspective. When we did activate some of these antigen tests for nursing homes, we did see false negatives and false positives. So the PCR test is going to be very important as a sort of backup. And as we look at our protocols for testing folks, we'll incorporate the PCR testing as a component of that.
I'm just wondering, is this test affordable for the point of, let's say, the Nissans or the Ingles or the Toyotas out there? Many of those people have medical personnel on hand. Will they be able to get these?
The target of the distribution is not really clear yet. What we've been told is really got to focus on schools. And if we think about, so right now, most of it is going to be available through the federal government. There may be some, once they're more available through the private sector, yeah, they'll be affordable. I mean, the price estimate we're seeing is like $5 a test, which is, obviously so much better than $100 we've been seeing. But right now, obviously, we want to focus on schools, colleges, nursing homes, vulnerable populations. And we'll see how the prioritization works as we activate the testing strategies.
Have you seen anything as far as what's your thought process as far as our trend in Mississippi? This morning we had 696 cases, 10 additional deaths. Your overview of that as far as trending?
I really think we're flat. Right. So, we've had a pretty good drop coming through the end of summer, getting into fall, and we've really sort of stabilized. And I think this is a really important time for us to kind of think about where we're going. I have been extremely enthusiastic about the success of getting kids back in school. And I will give all the credit to the school systems who have been very, very conscientious with prevention measures, masking, but also when they do have kids or teachers who have the virus, they've been very, very fastidious in their isolation and quarantine protocols. It's been aggravating, I understand, to a lot of parents for kids not to be able to do things, but that minor sacrifice has been able to keep kids in school.
You see anything with the cooler weather that this might ramp up a little bit?
There's always a concern of respiratory viruses in cooler weather. Flu, colds, it's always there. There are several different components to that, but certainly when people are indoors, because the weather is not good. We know indoors is the exact perfect way to spread coronavirus, especially if you don't have good air circulation. So the mask thing is going to be that much more important.
Dr. Thomas Dobbs, State Health Officer, were you in accordance with the governor lifting the statewide mask mandate on Wednesday?
From a public health perspective, we want everybody to wear a mask, and we're going to continue to promote that. We understand that there's a lot that goes into that, so whatever strategy works to both keep as many people in masks as possible, but also make sure that going into the future we have other public health tools available. I'll just tell you, Paul, that we want everyone to wear a mask because we know it works. We know it prevents people from spreading it. It keeps people from being super spreaders, but it also protects the wearer. We're learning more and more about how important that is.
I'm just interested. Do you have your mask there?
I do.
Show me your mask. I figure if you've got a mask, it's basically a cloth mask, right?
This is a cloth mask. Now, it does have, this is one of the ones that we got from the feds, and we've given out, I think, about 3 million of these to different folks. Yeah. And this one actually has a little bit of copper and metallic substance in the middle to kind of help trap any sort of transiting pathogens. But, all kind of masks make a big difference. Yeah. The gaiters probably don't work that well, certainly, but you don't want them too thick because you want people to be able to breathe and be functional.
That's it. I'm worried about some of the kids, too, because I heard some of the kids are having problems in schools. And I'm not sure exactly how you handle it, but I will agree with you. On a nationwide basis, it seems that we're doing the school thing pretty good. One final question, real quick, I want to sneak in here. How do you think the hydroxy taken by the president is going to play into this as far as a narrative?
I don't know. We'll see. There's a recent study by JAMA that showed it doesn't work in prevention. So, it will continue to see information as it flows, but, follow science. That's what we do.
You got it. Always good seeing you, sir. Glad you're healthy.
Thank you.
Stay in touch.
Thanks for having me.
Dr. Thomas Dobbs, State Health Officer.